I'm Nicole Henry, Doctor of Pharmacy. I am also district leader for CVS Health, where I manage 22 stores across Arizona, New Mexico, and Texas. I'm also assistant professor at Coit College of Pharmacy, University of Arizona, where I teach the Intro to Pharmacy practice class and the management course. I decided to go into pharmacy. When I was in high school, I was caring for a family friend, one of my neighbors, and he was on tons of different medications. I would go over to his house after school and help to manage those medications, put them in his pill box, and all I knew about them at the time is they were different colors and they meant different things for his health. Unfortunately, he ended up passing away. There was a drug error in his med box, and a drug interaction sent him to the hospital where he had a brain hemorrhage. I found this out after the fact when I started asking some questions of the providers, like what happened? You know, he went from being super healthy one day, and the next day I visited him in assisted living and his face was drooping to one side. So once I found out what had happened to him, I knew that I wanted to go into pharmacy. I wanted to make an impact for those patients, and I wanted to make sure that they had the information that they needed to make healthy decisions for themselves. And I was very heavily involved with ASCP. So ASCP, it's the American Society of Consultant Pharmacists. We work to make sure that older adults know how to take their medications and they know any side effects that might result from taking their medications, perhaps the incorrect way at a different time of day, taking it with a certain food, or any type of interaction that can take place. So being heavily involved in the ASCP student chapter, I actually started out when I was in high school. So, you know, just a reminder, it's never too early to get started if you're passionate about pharmacy or any field in healthcare. I went on to start the ASCP student chapter at the Coit College of Pharmacy, University of Arizona, where we brought together students from the College of Medicine, Pharmacy, Nursing, and Public Health. And we partnered with a low-income assisted living in the Tucson, Arizona area known as St. Luke's Home. And we worked with those older adults to make sure that they knew how to take their medications. That's why I chose to go into pharmacy. So how do you get started to become a pharmacy technician? Very first steps is to get involved with a pharmacy and perhaps a retail pharmacy. At our retail locations, you can start out by being a front store associate, which requires no experience whatsoever. We train you on the job. And we will support with paying for the fingerprint clearance card, which is required for you to become a technician trainee. You can go on and become the pharmacy technician trainee, and then we support as well with exam prep, so you can take the pharmacy technician national exam and become nationally certified as a pharmacy technician. So the best advice I can give is always to raise your hand to do more. Raise your hand for that opportunity. Make sure that people know that you're interested in doing more, and also ask for help along the way. It's very important to seek out mentors who support you on your growth and development journey, whether that's in healthcare or another field. It's always important to identify those mentors, get that level of support, and they're going to be there to take you to the next level.